here with Focus Physical Therapy. Today I'm going to talk about who mostly gets sciatica and how you're going to get it better. Well, good and bad news. Bad news, most everybody will get some form of this. So research shows that 95% of Americans will have some form of low back pain or significant spine pain in their life, which includes sciatica. Sciatica is kind of technically more of a garbage can term. What I mean by that is that people will have pain in their back or pain down their leg and they kind of just classify it as sciatica. So a lot of different ways that you can have pain down your leg. Sometimes it can be a true sciatica, which is a pinching a nerve root in your hip, which actually a lot of people don't realize that the sciatic nerve doesn't form until your hip. But most of the problems are coming from your back. And so that's where we need to look at. And oftentimes when people are failing with other therapies that they're trying, as far as stretches you find on the internet, or going to massage, or even other physical therapy places, if you don't get down to the root cause of where it's coming from, most likely in the back, oftentimes your results can be limited. A couple things about sciatica. First of all, it's really hard, and that's okay. Oftentimes when we're looking at these type of conditions, we want it to be better right away because the pain is so significant, especially when you're dealing with nerve pain down your leg. So when you're dealing with nerve pain down your leg, it's very kind of demoralizing. I know how that feels. I've had it myself actually, and it can be hard to get better. So how you get better, and first of all, most people will have it in some form during their life. And then how you get better is a multi-step process. First of all, realizing that you can get better. Oftentimes when you have pain down your leg or have nerve pain, if you end up going to a doctor or some type of specialist like that, sometimes they're a little bit confused of what to give you. And in general, what I tell people, there's only 5 things you can ever do to kind of get these things better. You can do nothing. You can do injections, surgery, physical therapy, or medication, right? Now, oftentimes surgery and injections, we can kind of rule out pretty quickly as far as whether you need that or not. That's something a physical therapist can do for you. And then we have to walk you through how to possibly use medicine if you need it. Most people don't want to take medicine. I don't want you to take medicine as well, but sometimes you just need it, but you gotta have a better kind of reason for it and also a better use for it. And also if you're gonna take something like that, you gotta make sure you're doing some active treatment for it as well. As far as how to actually get it better, I wish I can show you some individual exercises on sciatica, how to get that better just with a pure video, but if I did that, I would be kind of lying to you because everybody's different, especially with sciatica. Some conditions, I can give you a couple of tips on some exercise and stuff, but not with this. If you've had it, you know that, it's weird. It can change from day to day. It can be great one day, then bad another day. Feel it in one spot, then feel it in another spot. It's all over the place. And so if someone gives you kind of generic exercises, it's probably not going to help you much. You can do that if you want to. I actually have my website, 4 Ways to Beat Sciatica online. I'll go ahead and tell you some of the secrets in here. The first thing is just knowing you will get better. Sometimes this type of condition, you've had advice from people and you're like, we're never going to get better. It's like, well, actually you can. You just got to piece together the right thing. And most importantly with sciatica, you got to be patient. Back pain is different, but sciatica, you got to be patient. You got to be willing to put in 2 or 3 months worth of work to get this better. Other thing is getting active. Oftentimes sciatica, and if you watched our video on why it happens, inactivity is a big issue. So trying to find some way to get active. Now, it might hurt to kind of do certain things. So what can you do without too much increased pain? Now, a lot of sciatica actually does well with standing and walking. So just doing a walking program. If walking feels good, don't feel bad to do it longer. 20 minutes, 30 minutes, as long as you kind of don't have a significant increase afterwards, it's not a bad idea to kind of do some type of walking program. And then lastly, finding a good manual therapist or physical therapist that actually has experience with this. It's a hard thing to get through, and you need somebody to really kind of make sure to hold your hand through it. Make sure that you have patience to kind of know what to do each step of the way. So make sure that when you're going to your physical therapist or somebody that's having you treated, make sure it's a good fit for you as far as what is going to happen for the whole course of treatment with this. Because this usually takes 2 to 3, maybe 6 months to get better. Doesn't mean you'll be in therapy the whole time, but it's a journey to get sciatica better. Back pain is one thing, but then when you can have back pain and nerve issues, it's a whole different realm of treatment. And actually, even in our research and our practice patterns, it shows it can take a lot of visits, but you can get better. So that's the main thing you need to believe. This is how you get better. You got to believe you can get better, and you just got to get the work in to kind of do the right things to get there. Okay. So look at our website. You can fill out a free visit if you want to talk to one of our great therapists to kind of learn more about how your particular case can get better. You can also download some of our free reports to kind of maybe get some better advice or some simple advice for this. But feel free to kind of give us a call at 502-509-3136 or look at our website at physicaltherapylouisville.com to kind of get some free resources for you as well. Hang in there. It will get better. Hope to see you soon.